Do you remember the movie Wonder with Julia Roberts? The film tells the story of a boy who was born with a rare anomaly, Treacher-Collins syndrome. Today we want to talk about this rare disease. My name is Sasha Elbaum, and we are continuing the project I Want to Ask, where we talk about things that can be hard to believe. Your likes and comments help promote this video, and thanks to them, more people will see this story. Thank you. Treacher-Collins syndrome is a rare genetic disorder that significantly changes the face. People are born with abnormalities of the mouth, palate, cheekbones, and the skull as a whole. The disease is named after Edward Treacher-Collins, a British ophthalmologist who first described the syndrome in 1900. Downward slanting eye corners, a small chin, and a large nose make it easy to identify someone with this condition. The syndrome occurs in 1 out of every 50,000 newborns. Besides the issues mentioned, people with this syndrome may experience hearing and vision problems and delayed psychomotor development. There is no specific set of abnormalities. For each person with Treacher-Collins syndrome, the symptoms can vary greatly from one individual to another, even if they are relatives.
I found out about the diagnosis only after giving birth. Medical staff were hovering around me and I asked where my baby was, if everything was okay, but the nurses were silent and no one told me anything. After about an hour, a doctor came up to me and immediately asked, "Did anyone tell you anything during your pregnancy?" I said, "No, what happened?" She said, "Your baby is suspected to have Treacher-Collins syndrome." And then she told me, "Go ahead, tell me everything." My baby doesn't have ears, there's no ear canal, and there are no airways, so my baby can't breathe on their own, neither through the mouth nor the nose. In the last 50 years, doctors haven't seen a diagnosis like this, so it was the first time for me and for them too. And they just told me that maybe he won't survive.
The syndrome is caused by a genetic mutation, which is inherited from one of the parents in 40% of cases and appears spontaneously in 60% of cases. A parent who is not just a carrier of the gene, but who actually has Treacher-Collins syndrome themselves, has a 50% chance of having a child with the same condition. Come on.
First of all, it's impossible to do a complete genetic analysis, and right now it won't give you a definite answer as to whether you are 100% not a carrier. Yes, I have had such patients come to me for genetic counseling, and we addressed questions regarding the transmission of this syndrome to their offspring. There was a father who was a carrier of this syndrome. I think he went through about 26 surgeries and adapted quite well, but he really didn't want his child to inherit this syndrome. Later, we performed an in vitro fertilization procedure and selected embryos that were not carriers of this syndrome, and his child was born healthy. This is now the method of choice, so that abortions are not performed, pregnancies are not terminated, and women are not put at risk. This is the method of choice. And so basically, this is my job, this is my place.
Facial anomalies are usually symmetrical. Infants with Treacher-Collins syndrome have underdeveloped or absent cheekbones. Their main function is to hold the eyes in place and to form a chain with other facial bones and muscles. Because of the underdevelopment of the cheekbones, part of the face may appear flat or sunken. The lower part of the face is not fully developed, so the chin and lower jaw may appear small. Children may have an underdeveloped pharynx. As a result, all these anomalies can lead to feeding and breathing problems. For example, sleep apnea, a disorder in which a sleeping person stops breathing for short periods of time, can even lead to death. People with sleep apnea are forced to sleep with a special device that supports their breathing.
Our syndrome has affected us in every way. The children mostly get by, but almost all of them have hearing loss. Almost all the kids wear these bone conduction hearing aids, because even if they have an auricle, they don't have the ear canal itself. We have clefts of the soft palate, lower jaw issues, absence of the posterior branches, and cheekbones. Mark is 3 years old. We've already had 6 surgeries. His first surgery was on the 4th day of his life. He had surgery for choanal atresia. They made openings in his nose. Then the second surgery was the placement of a tracheostomy tube, which he breathes through, and after that we had another surgery in Israel. He was fitted with a feeding tube through an endoscope. He doesn't eat on his own. And there they put in a gastrostomy tube for him.
Here it is.
He is fed through his tummy. Last year in November, we had surgery in Moscow to repair a cleft palate. And now we are planning surgeries on the jaw. And finally, God willing, all of this will be over when they remove all these tubes. So there are still a lot more surgeries planned.
A person with Treacher-Collins syndrome may have speech difficulties, problems with hearing or the jaw, and their ears may be misshapen or turned. Now let's talk separately about the eyes. There can be a tissue anomaly around them, which gives them, if I can put it this way, a sad appearance. But that's far from the worst problem. People with Treacher-Collins syndrome can even lose their vision completely. Their intelligence is usually not affected, but there are also cases with brain abnormalities. What does this mean?
The thing is, brain abnormalities in this syndrome are rare. Only 5% of these patients have such issues. Mostly it's facial anomalies, or as we say, facial dysmorphia. And here, let's say intellectual delay is more often related not to brain abnormalities, but specifically to hearing impairment. And from an early age, children can't develop the way they would in normal life. For children with normal hearing, it's important to restore the auditory analyzer as early as possible, meaning the use of hearing aids, so that the child can be adapted and developed from a very young age. And in such cases, intellectual impairment is minimal for these people. They may look different, but their intelligence rarely suffers, which is probably what causes them the most discomfort. Because our society is not very ready to accept people who are different from certain standards.
As it was later explained to me, we also had a curved larynx. The baby wasn't breathing in, and they had to put him on a ventilator. But all of this was very difficult to do because of the curved larynx, and Mark was without oxygen for 20 minutes. So we had postnatal hypoxia, and because of this hypoxia, we are having problems now. The problems are specifically with delayed psychomotor and physical development. Just a year ago, Mark couldn't even sit on his own. It's difficult with breaks, but he is able to move around. And of course, his psychomotor development is not at the level of a 3-year-old, but rather like a younger child, about 1.5 or 2 years old.
A logical question is whether this can be completely cured. No, but there are some nuances. To be continued.
Unfortunately, at the moment, treatment is only symptomatic, meaning when patients with this pathology are identified or born, the first and most important thing for them is to ensure proper breathing. The second is to give them the opportunity for their brain to develop in time, which is very important for them. If there is a hearing pathology or facial anomalies, they are corrected with surgeries. However, the question of surgery is decided depending on the age, because a child's face continues to grow. And if surgery is done too early, the deformities may become even more severe than they would have been originally. That's why children have to live for quite a long time with how they were born, and only at a certain point can they be scheduled for surgery to correct their appearance. Well, let's put it this way, it's more for aesthetic purposes rather than to correct any function.
The first year was very, very hard for me. I couldn't believe that such a misfortune happened to me. It was really difficult. To be honest, it was just really hard. My husband supported me, of course, and when Mark turned 1.5, I went back to work. So my husband's mother, my mother-in-law, helps us. We live and enjoy life. We just started appreciating the little things, those little things that an ordinary person might not even notice. We started enjoying the sunshine. Oh, the weather is nice today, that's great. We live, we rush outside to go for a walk, we rush outdoors, we get dressed, we spend time outside. Whenever we have a chance to go out, for us that's already happiness. We woke up today feeling great. Little things like that, everyday things, for us it's already a huge step forward.
Just like in the episodes Being Young and Being a Mom, We try to talk about such rare diseases so that society can better understand people like this, and so that life becomes a little easier for them. We hope you enjoyed this episode. See you soon. Bye bye.